Wow, there are a lot of you. Good morning and buenos dias. This is my first time on your college campus, and your faculty and some of you are most impressive. My sincere thanks to Dr. Maxwell for inviting me, and now I shall begin. As a student, I have sat where you are sitting in 4 different institutions. I look at you and I think, with a sense of wonder, I look at you with a touch of envy and a tad of, ooh, they have no idea what's coming. My college years, perhaps like yours, were packed with a myriad of awakenings, both personal, certainly spiritual, and professional. Periods of peeling off the old habits and I had learned at home and putting on the new. And what I did not know is that every experience I had would open a whole new world of possibilities. God used every moment, every failure, every success, every confusion to shape and mold me for what lay ahead. And he's still doing that. So I've been charged this morning to be transparent, to share my journey. That's all I have, so that's what you will receive. And if I hear any of the quirky things that I say repeated anywhere, I'm coming to get you. I am one of 3 siblings. I am the daughter of a veteran Army, Louisiana-born father who graduated from the 8th grade, and he served in Okinawa. And he worked for General Motors for over 30 years. My mother, Georgia Peach, the first from her family to graduate from college and retire from Wright-Patterson Air Force Base after 25 years. I've also admired my parents' hard work. And at the age of 5, I remember looking up heavenward and saying, Lord, please make me somebody that can be a person to make a difference. I want to give back significantly in some way. I want to do something for you that matters. So please, Lord, make me smart, maybe an astrophysicist. I didn't have a clue what that was, but I knew it was something great. And then I can do something that really matters. Well, I gravitated toward music. As a child, I remember in church, women who were very old and arthritic bound would walk in the church with this, holding on every pew, and by the time they got to their pew, they would sit down with such a thud that it hurt to even hear it. But you let the gospel choir get up and start singing. I got a home up in that kingdom, ain't that good news? I got a home in that kingdom, ain't that good news? Well, these women, the arthritis was gone. They would start walking and moving, and in such a way that I said, what did that? Or we had this usher who was as stiff and rigid as I've ever seen. And nothing moved him. When people came in, they kind of avoided his line. But you let one of our our soloists in the Templelite choir. They sang more anthems and hymns. And he would melt. His eyes would just run over with tears, and his whole body would shake, living in the moment of the music. And I wondered, what is it in music that transforms people without their even asking or saying or deliberately trying? Little did I know that my mom started me with piano lessons at 5, a teacher at 16, voice lessons, and then that same teacher thought I should audition for her school, for her alma mater, University of Cincinnati College Conservatory of Music. And not only did I audition, but I got in, and on scholarship. My favorite person in there was my roommate, Kathleen Battle. And so she and I took a journey unlike that of many others that looked like us. So after graduation, I sat there in my seat, much like you are now, and I said, but Lord, I said I wanted to do something for you significant. All I can do is sing. And nobody takes music seriously, except rappers and that sort of thing. I mean, but what is it? Did you forget? What I was not prepared for was what came next. And let me demonstrate with you a music therapy way of saying what happened next. Would you repeat after me? Repeat after me. I meant to tell you, if I see anybody messing up, I walk down off the stage, I find you, and I kiss you, okay? All right, here we go. 1, 2, my turn first. Beautiful. You all are good, very good. All right, this time, clap when I say clap, and stop when I say stop. Can we clap and clap and clap and clap and clap and clap and clap, clap and clap and clap and clap and everybody stop. It was you, wasn't it? So, no. So somebody sitting next to him said, all right. They tell me if I walk down here, I didn't tell you this, Joey said the whole thing, audio-wise will start screaming, so I can't do it. But I'll find you after this is over. Okay. Last time. Can we clap and clap and clap and clap and clap and stop? And clap and stop. Yeah, most of you are getting it. And gotcha. Okay, what just happened is we set up a pattern and I deviated from it, and it threw everything off. That's what happened in my life. Because when I was invited to Curtis Institute of Music, which is comparable to a Juilliard or an Eastman, for free, what happened at the end of that first year, we're all assessed to come back or not. And I was on the not list. I was told by Rudolf Serkin that I should study more technique. And as a result, he would re-audition me the following year so that I could return. I ended up going back. I was very disappointed in me, though I had tried my best. And I went back to the University of Cincinnati. I became engaged. I became pregnant. I married. And if you listened, things happened in that order. And the unfortunate part was I felt I had disappointed God yet again. And I wondered whether he could use me or not. Now, 47 years later, I can tell you that husband of mine is outstanding. He has been the biggest support in my whole life, and there's no doubt in my mind that God wanted us together. We had the most marvelous little boy, who then, 5 years later, I took back to school with me so that I could finish what I started. So after all of that was over, I looked into the catalog to see an elective I was going to take, and it was Introduction to Music Therapy. I took that course, and my life has never been the same since. Yet, what I wasn't aware of was just how much it would change who I am and what I do. The significance of wanting to make a difference was holding on very strongly. So this is what happened. It takes 4 years to get a music therapy degree. You take anatomy, physiology, psychology. You learn to play, in my program, one instrument in each of the orchestral families. I had to learn to compose and conduct and sight sing and play 2 instruments with proficiency. By the time all of that was finished, we had to do a 6-month internship. And during that internship, I went to 5 different places to conduct music therapy, much like a student teacher would do. And I worked in a psych unit that was locked, a nursing home that when I walked in, the smell of urine was so strong, it made you choke. I worked in a home where children were severely physically and mentally handicapped. And I worked at a school for developmentally delayed, psychiatric children who were their behavior was, you would probably say, off the chain. And a blind student who wanted to learn to play piano, and a 2-year-old who had never spoken. I was hired immediately after that internship was over at one of those places, and it was at a developmental center where there were 247 children who were severely handicapped, multi-handicaps. Joey, did not know how to say anything. He was 4 years old, and all he would do is this, and flap. And I remember taking a toilet tissue tube, sitting him in front of me. All Joey would do was sing his name. Joey, Joey, Joey. That's all. I took the toilet tissue tube and I said, Joey. And he's tactily defensive, so I couldn't touch him, but I just put it like this, as if to say, your turn. That's all I got. Joey, Joey, Joey. I'm seeing if he's going to change and modulate his tone. Joey. He did. I put the toilet tissue tube down and began to say, Joey, Joey. He was getting it cognitively, responding behaviorally, just like I hoped. I began to pick up a drum. Drum! Put it down. Done. Maraca. Maraca. And we kept going for 20 minutes until his teacher came back. And instead of hearing, Joey, Joey, I said, Joey, stand up. We walked over to the door. I opened the door, and there stood his teacher. And I said, hi, Miss Eileen, to Joey. Hi, Eileen. She dropped her teeth, just hearing, and I did, ooh, because of the immediacy of just working with a child for a minute with the wonders of music and what it can do for the brain. I worked there for 6.5 years, and there was another bump. And that bump was, I was diagnosed with cancer. I had always wanted to work in a hospital, but I had no intention of getting there that way. I went for treatment, And I noticed that all the people around me needed the calm, the peace, the care that I wanted. And I knew that music could be that for them too. After my treatment was over and I attended a support group, I ended up giving an in-service, finding out that I was grateful for being able to talk to people just like me. And I wrote a song that reflected my gratitude and asked could I sing it the last night of our support group. They said yes, and I did. And the head of that group went to the American Cancer Society, who sponsored the group, and said, you've got to hear this song. It's from somebody who's walked a mile in these shoes. I went down to their office and sang it. Now, what I didn't tell you was, I began that song, I asked a week in advance, but I forgot I said that, and seated on the toilet 30 minutes before the group was when I remembered it. And that's when I wrote the song. So I shot off after a flush and went right to the meeting, and have mercy, I sang it for them, and they sent me to a recording studio to put the song on tape. Now, what about that? From the stool to the studio. And as a result, I had the opportunity to start talking about music therapy as it relates to pain management and anxiety and cancer in general. And I was able to do multiple presentations, and I was asked to come all across the country. I was called into the office of the head of the cancer center within 6 months because I volunteered to go there and do music therapy. And I was called in, and his desk was about this big as he was, and he sat in front of him as, not even please sit down, but when I walked into his office, called me on my full-time job at the developmental center. And this is the way the conversation went. I hear what you're doing with my patients. I hear they're taking off their oxygen mask and singing with you. I also understand that our nurses now, who haven't played instruments since I've been here, are pulling out instruments from under their beds, long, not used, bringing them in and playing for these patients in the middle of the night when you're not here. And I have letters on my desk telling me from their relatives what you're doing with their loved ones. And I have 2 questions for you. You all, I had a grip on the chair I was with. Just question 1, when can you come to work for us? And number 2, how much money do you want? That's how the job started. God is amazing. He had listened to that prayer, and in his time, he did some marvelous things. May I take you to the hospital on rounds with me? I want you to see some of my patients. Okay, let me tell you. This gentleman is in his 40s, has had a stroke. He has a very uneven gait. And he's trying in rehab. Now, you don't see a music therapist here. What you will see, the music therapist standing back, watching his baseline, how he's walking. And then she establishes a rhythm that she thinks cadence would be helpful in his gait. And the OT, the physical therapist, is working with him. I want you to listen for the metronome and watch if he entrains or not, how it affects his gait. So you'll see a baseline first.
Quick grab the bar. Get over a little bit, and I'll guard you, okay? Right there, like, start what you're doing. No cheating on the bars. Okay. Okay. Stop. Really?
tell the difference? Now, here's another woman, double braces. She has no arm swing.
That good?
She needs a gait belt, someone to securely walk beside her. And these are slats about a foot or so apart to have her lift and go over. And I'm thinking, you add music to this, and it's simply going to be praised. I mean, it's going to add to her confusion. Now, some of you might think, well, darn, just turn on some music and let somebody walk to it. That's not what's happening. What's happening is the space in between the steps is being systematized in the brain in order for that woman to know, this is coming, I've got this much space in between, and therefore I have to walk at this pace. Motor memory is a wonderful thing, and using music to help govern that is amazing. I want you to see one of the times that I was able to go to Africa. I was invited to come, and I went to one of these way far out in the boondocks clinics. Nothing there except women and their children who had walked for miles to get there. I understand that you are mission-minded here. And of course I'm thinking, well, Lord, if I was a surgeon or something else, I could really, but music, and I'm going to a place that has so little. They took me to a clinic where Cynthia, a little 2-year-old, was. There had been a fire in her house. She ran out, but she realized someone was still in the house. She ran back in and was severely burned. I'm going to show you, when I met her, they told me, number one, she doesn't socialize, she doesn't interface with any of the children, she does not speak. Please don't expect a lot from her, and don't require a lot from her. All I had was a margarine tub. It was empty, and I used it as a drum. Okay. Cynthia's on the floor.
Why'd you wait till I took it away?
Can you do that? You can see she wants attention now. Now, Cynthia did do the uh-oh in that. Every time she did, the person who was doing the camera stopped, but that's okay. That was very meaningful for me. All right, let's see if I can do this correctly. I want to take you to, okay, that's where I work, guys. Did for 34 years. It's a 1,000-bed hospital, and those are some things I talked to a class about yesterday, how we measure what we do, how we assess what we do, where I go. And the OR is one of those places. But I want to take you to, this is Sam. He was one of my interns. He has a ponytail, and he's working with sickle cell patients and relating to them in ways that are unbelievable. has done research with them to determine how music can affect their pain, and his outcomes were significantly better than their pain levels. Now, this person was recommended by his physician, who told me he's going to have a laryngectomy. He will never be able to talk again normally, and he's a doo-wop singer. So would you go see him? And I'm thinking this may be contraindicated to see someone whose memory and mood is governed by his memories of being a doo-wop singer. We talked. He said, lady, if you can do anything with what I, am going through to help somebody else, or if you can use your music therapy techniques to help me learn how to speak again, I will be happy to do it. And so we did some wonderful things throughout his time there. But when he got ready to leave, let me show you what we do. I create a discharge song for him and go in and sing it. This is my intern who decided she wanted to sing it for him. Tell me, do you think it was contraindicated that music therapy be a part of his treatment?
I'm leaving today. I know I want to be a part of it. New York, it's up to you. New York, You make it awesome.
We had a wonderful relationship. He would call me on the phone and leave messages in my office. And he was in search of a savior as well. This is Sam. I'm going to do it very quickly. He has hooked up things I'm sure you're familiar with.
Okay. All right. Like we said last flow, stay hydrated, pray and take your meds. And don't you won't end up in the bed. Hey yo, all I'm trying to say is that this and what Sam doing is making a way for us sickle cell patients to free our mind. And sometimes it's tough, hey man, sometimes it's rough, and sometimes you don't know what you gonna do. But with your Sam standing here and with the keyboard, man, I'm good, starting to feel like I can't walk.
This was a sickle cell patient curled in the bed in a very fetal position. Sam came in and he was up. These are sickle cell patients we bring into the lounge on the floor, drums. Some of them have their families to come. And we sing and play with the songs that with which they're most familiar. A little bit of will. Each is contributing a word. A little bit of power. Now, the man in the bed is the patient. His sister has come from California to see him.
Now I want to hear Gina on the piano.
She's playing on an iPad. She's not musical, but listen.
Yeah. What's going on?
She's surprised at herself.
Yeah. Woo. Now I'm gonna pass it over to Jay on the vibes.
This is all the equipment we use and that Sam has taught me to use. Confusing stuff, but we are able to take all of that into a patient's room to record with them. This one is one of my favorites. Mr. Mercer has had a stroke, a very dignified man, deacon in his church, and he can't speak. Everything is, and finally I say, Mr. Mercer, let's try singing. I'm using a technique called melodic intonation therapy, but this is the primary before. I hold his hand, I give him some kinesthetic input, and watch. I know he knows this song.
This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine.
Watch his mouth.
This little light of mine, I'm gonna let it shine. Let it shine, let it shine, let it shine. Yes, everywhere I go, everywhere I go, I'm gonna let it shine. Let it shine, let it shine, let it shine.
We know that the brain is damaged when there is a stroke. But what music does, it creates new neural pathways so that if you're trying to say hello and it doesn't work because that's damaged, you can create new pathways in order to accomplish the same thing. And music can do that. In short, a toilet tissue tube, a failed educational year, a cancer diagnosis, an empty margarine tub, all tools to a life of meaning for me. I've had my college friends say, Deforia, with a voice trained, you're going to go around and shake rattles and talk to people who are dying or people who are sick. You're going to talk to an Alzheimer's patient and sing to? I mean, come on, Deforia. That's kind of a waste of talent, isn't it? And a waste of what you did. How dare you take the sacrifices made by your parents and all the work that you've put in and go do that. It has been the most significant part of my life. Did I trade the stage for a hospital bed or sitting on the floor of a clinic? Yes, I did. But I still carry that love of music with me. I tell you these things because you may think there are parts of your life that keep you back, that won't let you blossom and be who you are. Know that God is big enough and great enough to take every part of you, who you are, what you do, what you can't do, and make you a person who can serve him with significance. Trust in the Lord with all your heart, and lean not unto your own understanding. In all your ways acknowledge him, and he will direct your paths. You're going to help me end by singing with me, in tune. And you know that the highest praise is the word hallelujah. I had the privilege of standing next to a man whose favorite song was hallelujah, but his favorite verse was, I will serve him, I will serve him. And I'd like for you to sing that with me in harmony as we leave, breathing it and singing it as a prayer of commitment to what God can do. Hallelujah.